So this is patient CW. He is a 56-year-old male. He is 70 inches tall, 122 pounds, 55.4 kilograms. His BMI is 17.5, putting him in the underweight category. His usual body weight is 160 pounds, and his ideal body weight is 160.6. The patient does report a weight loss from 160 to 120 pounds over the last year, putting him at a negative 23.3% weight loss. And then per the hospital records, he does have a weight loss of 21.7 or 21% in the last year. His chief complaint was vomiting and nausea, which has been going on for multiple days. He wasn't able to provide a specific amount of days, but less than a week, he said. And then his primary diagnosis includes probable gastroenteritis, GERD, hypertension, hyperthyroidism, iron deficiency, and hyponatremia. His secondary diagnoses include sciatica due to multiple herniated discs, back surgery in 2021, chronic pain, most likely due to the back surgery, he thinks, arthritis, history of alcohol abuse and recovery for 3 years, and then a chronic tobacco user. His past hospital admissions date all the way back to last July. With my hospital, we don't go past 1 year just because it's no longer significant for weight loss or gains. So we just look at 1 year, and he's had 7 admissions in the last year, 2 of which were just emergency room records. And then within his labs, his sodium and potassium were off. His sodium was a little low, his potassium a little high, most likely just due to the electrolyte imbalances whenever you're puking a lot. And then his BUN was a little high, along with his bicarbonate was also high. And I just noted those for kidney levels just to, as we follow along with this guy, if he stays in the hospital for a while, we want to check out his kidney levels as time progresses. His medications include omeprazole for GERD, which he takes ongoing as needed, methimazole for hyperthyroidism daily. He takes ferrous sulfate for his iron deficiency, takes that daily, and then he takes cyclobenzaprine for his sciatica pain as needed, and that's an oral supplement. He is not married, but he does have a fiance. He has a high school education level, and he's currently not working due to the pain. So for his lifestyle history, he states that he is in recovery, and then the medical records at Sarasota show that he is in recovery for 3 years, but he did state to me that he had a few drinks a couple days ago. And then he's a daily smoker, a pack a day. He does not exercise, and then he sleeps about 4 to 5 hours a night. So when completing the nutrition care process, the problems that I wanted to focus on would be the malnutrition and then the deficiencies related to that. The weight loss, and then the diet due to the ill-fitting dentures, which I might not have mentioned, but he mentioned that he got dentures 3 or 4 years ago when I asked him if he had any chewing, swallowing issues, and he states that they don't fit, so he never wears them. Therefore, he can only eat certain foods, takes him a while to eat, things like that. And then nutrition education on taking potassium supplements without direction by a physician or RDN. He also shared he takes potassium every single day. I asked why. He said he just thought it was healthy, so I would want to educate him more on that. And then for the nutrition assessment, I noted mild fat losses in the orbital region, mild muscle wasting in the temporalis and clavicle. And then his energy needs are based on his admit weight of 55.5 kilograms and his underweight BMI of 17.5. So 30 to 35 kilocalories per kilogram. So 1665 to 1943 kcals a day, 1.5 to 2 grams per kilogram of protein, so 83 to 111 grams of protein, and then fluid 30 to 35 milliliters per kilogram, putting them at the same 1665 to 1943 milliliters a day. And then whenever I did the nutrition focused physical exam, I was able to gather information to help diagnose malnutrition with him, but his food and nutrient intake is less than 75% of the estimated energy requirements for greater than 3 months. He states in the last year he eats 1 to 2 meals a day. And then he has had a greater than 20% weight loss in a year. And then I was able to note the mild orbital and then the mild clavicle and temporalis muscle and fat losses. And then he had no edema and then no reduced grip strength that I could notice. So his PES statement is moderate environmental malnutrition related to chronic pain due to sciatica and back surgery, ill-fitting dentures for 3 years, and a history of alcohol abuse is evidenced by mild fat and muscle wasting, less than 75% of estimated energy requirements for more than or equal to 3 months, and a weight loss of negative 21% times the 1 year per the SMH records. And I did environmental malnutrition just based off of the categories he fit. And also the chronic pain and the back surgery aren't the most pressing issue for his weight loss. I realized that it was the dentures over our interview. So for the intervention, I'm going to have him taking an Ensure Plus high protein shake daily, eventually go to 2 when he feels, he's ready to start taking 2 a day. A daily multivitamin, but I did suggest Nipro because it limits the phosphorus and potassium if those kidney levels get worse or don't improve, just in case there's some underlying issues that we're not aware of. Provide the patient with services to get the dentures fitted properly. Educate the patient on soft foods while awaiting the dentures to get fixed, so just giving him a more balanced diet while he's eating soft foods. And then this one is not necessary, but in at Sarasota Memorial, they want us to pretty much be ahead on your dietitian notes. They want you to look ahead, consider all the alternatives that might happen down the road and note them. So because he's malnourished, I did say to consider tube feeding if the patient is unable to tolerate PO intake for 10 days. That's just our protocol. So if he was here that long, which I doubt he will be, then we would look into that. And then for nutrition monitoring and evaluation, monitor the oral nutrition supplement intake, his PO intakes, make sure that's getting better. GI functioning is kind of routine for us. Monitor the sodium, potassium, bun, and bicarbonate, and then monthly check-ins with a dietitian, outpatient most likely, to present a 24-hour food log. And then that is all I have for him.